Welcome back. Returning to normalcy, Mississippi and Texas become the latest states to end all mask mandates and reopen businesses at 100% capacity. Texas Governor Greg Abbott warning that, quote, removing statewide mandates does not end personal responsibility. Joining me right now is the University Hospital of Rutgers Medical School CEO, Dr. Shereef Elnahal. Dr. Shereef, great to see you this morning. Thank you so much for being here. Now we've got these mask mandates going away. Do you expect other states to follow? And what is your take on this?
Thank you so much for having me on. So, first of all, I do think it's a little bit premature to be doing this. I wish they had delayed a little bit, just because we don't have herd immunity yet with the vaccination effort. We do have all 3 vaccines at our hospital now, and it's extremely exciting that we're able to vastly expand the number of people we're doing. In fact, we almost doubled the number of vaccines we get week to week now with J&J, which is extremely exciting. So we will get there. I do wish that states, though, take the time for us to reach herd immunity, because we know from Israel's experience that doesn't happen. The effects of that, I should say, don't happen until we reach about 40 to 50% of the population. So we're not quite there yet, but it is exciting. And I do think people who are vaccinated will be able to do many more things over the next few weeks.
Yeah, I mean, I guess it was about the mask mandate was about potentially, breaking the hospital fundamentals in terms of having too many sick people at once. And they say, well, now, the numbers are down. So that's why they're looking at this as progress. But you think it's premature. Let me ask you about the CDC, and it's poised to release guidelines on safe ways for Americans who've already been vaccinated to return to some form of normalcy. What are some recommendations that you believe we will follow in the foreseeable future for those people that have been vaccinated?
Thank you for asking that. So I do think, first of all, that we have 3 very good vaccines, and that's not emphasized enough. Operation Warp Speed really did miraculous things, frankly, within the span of a year to develop these vaccines. And so they're actually better than the flu vaccine, which people are much more comfortable taking every year. And because of that, I do think we'll see a lot more latitude in people who are vaccinated to do many more things. We already saw the CDC, for example, say that if you were exposed to someone with COVID-19, even closely for 15 minutes or longer, that you don't have to quarantine. And so that's a sign that you may see relaxation in the ability to travel, relaxation in the ability to gather, especially your loved ones. I mean, we're going to be able to hug our loved ones again without having fear of spreading this disease. And so you're going to see a lot more coming from the CDC on this, and it's very exciting.
Yeah, I mean, one of the most important things most people will say was President Trump and the warp speed with which he was able to lead corporate America in getting regulations down, in terms of getting this progress going with these pharmaceutical companies able to produce a vaccine within 10 months. Now you've got new information from the corporate sector. President Biden discussed it, this partnership between Merck and Johnson & Johnson, where Merck will help J&J manufacture J&J's one-shot vaccine. We are also hearing news that President Biden says we could have enough shots for all American adults by May. That's 2 months sooner than people thought. Your thoughts on the J&J vaccine and how this changes the dynamic?
It really does change the dynamic. So first of all, it's a single shot, which means by definition, we're going to get more people fully immunized faster. Second of all, it really does add significant stock to the total pool. So we're talking about 200 million people's worth of vaccine from the first 2, Moderna and Pfizer. Johnson & Johnson's adding almost 100 million by the end of May. And so by definition, you're going to cover the 260 million adults in the United States. The deal with Merck and Johnson & Johnson is very significant, because by the time that ramps up, we're going to be able to assist the rest of the world with vaccination, which is important because, again, a lot of the folks that brought COVID-19 to the United States were from other countries. And so it does keep us safer, especially when we vaccinate countries where there's a lot of transit between the United States and those countries.
Dr. Elnahal, are we going to get this vaccine every year? Is this going to be like the flu shot where we're going to have to get a booster shot every year for COVID?
It's a good question. It's one that we get all the time. We don't know yet. So we are going to see some of the data mature in the clinical trials, especially the Moderna and Pfizer trials, which have been going on for longer, about how long immunity lasts. So immunity may last only a year, it may last 5 years, it may last for 10, 20 years. We don't know yet. The question will be answered with the science.
Okay. Well, we'll keep watching that and talk with you along the way. Dr. Shereef Elnahal, great to see you this morning, sir. Thanks so much.
Thank you.